All right, so let's talk about lateral canthal rhytids. Of all the different procedures, I think this is one of the easier ones, you know, let's say compared to frontalis. Frontalis is actually the most common area, but it is the one area that I think could be the most challenging, because if you make a mistake or if you do something that's not exactly right, this is where the asymmetry is going to show up the most. So the person's eyebrow will be higher on one side than the other. Okay, so this is one area that you got to be extra, extra careful, and I'll show you exactly what you need to do so that you don't make any mistakes. And that 2-visit technique is a big help too. All right, and explain it to the person. Tell them, say, you know, we're going to be working on you today, and you're, as a new patient to me, you know, one of the side effects is one eyebrow could be higher than the other. Usually not. It hasn't happened to me, but if it happens, it's very easy to correct. We'll see you a week later, and we'll do a little touch-up. All right, so all this stuff is very, very easy to correct if you're off a little bit. All right, now getting back to lateral canthal rhytids, let me go over the technique with you. All right, so to start, okay, let's start right over here. Obviously, this is lateral, so the muscle that we're injecting is the orbicularis oculi, and we're going right outside the orbital rim. So the first thing that you do is you put your finger on the corner of the orbital rim, all right, and you're injecting outside the orbital rim. And let me do this. If I could just, you can leave that right there. If I can just borrow somebody for a second, and I'm going to do like a, who would be a good, can I borrow you for a second? Do you mind? Thank you very much.
You're welcome.
Now we're going to go ahead and really inject her, and it's going to be very painful, but you know. All right. So what I wanted to show you is where you're going to stand in the exact technique. Okay. What I like to do is, if you're going to inject a person's left eye, stand on the opposite side.
Thank you.
Yeah. Thanks. So stand on the opposite side. So if I'm going to be injecting over here, I have them over here. I tilt their head a little bit like that, and then I place my finger. Obviously, I'm going to have gloves on, right on the corner of the orbital rim like this. And you're doing a couple things when you do that. Number one, you're protecting the eye. Number two, you're pulling the skin so it's taut. So when you go in with the needle, you're not going to torture the person. You ever see that when somebody's going really, really slow and they're just dragging the needle through the skin? It's very painful. So when you put your finger over here and you pull back a little bit, you're making the skin taut. Then you go in with your needle and your syringe and you inject medial-laterally like this. Okay, the other reason why that's important is I've seen on videos where people will come around like this and they'll inject this way. And you're going to get results and everything, but why do you think that that's bad and dangerous? I mean, God forbid you slip or something like that, you're going to jam the person right in the eye. So or if they move, yeah, that's right. You didn't even think about that. If the person moves, God, that would be a really bad accident. And I see people doing that all the time. So stand on the opposite side, medial laterally, bring your finger in, then come around over here, all right, and then do the same thing on this side. Now, when I'm working on a patient, what I usually like to do, all right, is I like to work on that area first because they don't see too much of what you're doing. So I have the person over here. I've done the whole history and physical. I've talked to them. I've documented exactly what I'm going to do. I have my medicine and I prepare everything over here. And then what I do is I come back over here and I continue talking to the person like this. And my hand is over here, so they're not even seeing the syringe or the needle. And then I explain to them, okay, and that's as opposed to walking up to them like this. Right, so you walk up over here, and what I like to do is the lateral canthal rhytids first, and I explain to them, okay, so we're gonna inject right along here, and you'll just feel a little pinch, so if you could just turn your head a little bit, and they've never even really seen the needle, and then you just go and you inject along that side. So, okay, thank you very much.
It's almost as if we're treating them as if you're a smoker and trying to keep the smoke out of them.
Exactly, exactly.
It's like that space, you're giving them that space.
It's very, very true. You know, again, this is cosmetic, so you want to be really delicate with what you do, all right? And you also, when you're placing your finger in the middle of a procedure, I see people are putting it on the person's nose or in the corner of their eye. You know, try to be as delicate as possible. Don't ever let, and I see this too during the programs, don't ever let blood drip, you know. I get so annoyed sometimes where I see like the person did a corner of the eye or something like that, and it's dripping, it's about to go on their shirt, you know. So be careful. This is not like a really invasive procedure that you should see all this blood. So anyway, That's basically the technique as far as is protecting the eye. You're injecting medial laterally. All right, now how much? We haven't talked about the dosage. Okay, remember we said for that first visit, this is somebody you've never seen before. You don't really know how good the results are going to be. You don't know what's going to happen a week later as far as if you did enough or whatever. So just to be conservative, I would inject between 8 to 12 units. All right, we can go up to much, much higher. All right, remember from the charts, we can go up to a much, much higher dosage. But on that first visit, 8 to 12 units, have them come back 7 to 10 days later and do a little touch-up if necessary.
You mean 8 to 12 units for both sides?
On each side.
On each side?
Yeah, definitely on each side. Okay, and you know that you could go up to, how much can you go up to on each side? Do you remember? Up to 30 units. So again, that's a lot. Think about it. You're doing 30 units on each side. So 30 units here, 30 units here. That's more than half the bottle. So just start with the lower amount. Start with the 8 to 12 units. Okay, I would say more on the 12 for crow's feet. And
What's the frequency that you have actually? Because I know you've done
the frequency of what?
that you actually do have to go up to 30.
Oh, I don't use up to 30 very often at all. Yeah, it's usually around, it's hard to say around because everybody is so different, but I'll tell you 8 is very little. All right, I'm telling you that right now, 8 to 12, just so that when they come back a week later, you'll know what that 12 units does. But 18, 22, 24 units per side, that's a lot more common. 18, 20, 24, 16 per side. And there's also a skill. Sometimes, even after you've seen the person regularly and you know the correct amount, you have to work with them on their budget. I always don't like it when I go to somewhere and somebody asks me, "What's your budget?" If I'm about to buy something, they say, "What's your budget?" I'm like, don't worry about my budget. What does it cost? But in this, you almost have to ask them, what is your budget? Explain to them, say, I'm charging $10 per unit, so I want to be able to figure out exactly the amount I can do and space it out correctly with your $300, let's say. So that's kind of a little trick too. Here's a pretty good picture, if you could see this. All right, this is the injection. Again, it's not an intramuscular injection, but your goal is to get the medicine close to the muscle. So what you're doing is you're injecting subdermal, just beneath the skin, just beneath the dermis, all right? And it will get close to the muscle. And remember, Botox works by blocking the release of acetylcholine at that neuromuscular junction. So you do want to get in the right place. You may or may not see that bubble like you see when you do a tuberculin skin test. So that's not a key, that's not a key indicator or something to look for. But you may or may not see that little wheel, okay, depending upon the texture and the tonicity of the person's skin. But that is a technique. So you go medial laterally, you're injecting just a little bit underneath the skin, and you go right around the area over here. All right, and you're injecting again 12, 14, 16 units. Here it says intradermal. All right, but again, and I told you you'll see different terminology, but we want to get the medicine as close to the muscle as possible. When we're injecting in the center, it's intramuscular, directly into the belly of the muscle. When you're injecting on the lateral canthal rhytids, it's just beneath the skin. So I would say subdermal. Okay, and here are a couple different examples. So let's go through each one just to see what it would really be, as opposed to, as far as the injection, if it's somebody that you've known for a while. So if I had this person, all right, and this is all they had in that area, what do you guys think? Just throw out a couple numbers. They're all going to be correct, I'm sure. Let's say 12 units. 12 units, you get a nice result. All right, you have a very nice result. You could see the patient back. That would probably be, because those muscles look kind of thick. I'd probably probably be closer to like 16 to 20 units for that, because those, just from that, it's kind of a small picture, but muscles look kind of thick. So I think 16 to 20 would give a very, very good result. But you could do 12, and I think the person would be happy with that. Okay, what about this? What do you think would be here? Look how thin the muscles are. Very, very thin. I would say 4 and 4, 8 units. Okay, that would be perfect. Now, you're kind of looking at this area, I think, everybody. But look a little closer. They've got a lot of wrinkles over here too. So maybe you do 4 and 4, and then just go around in that clockwise and do 2 units at each one of those locations. Okay, how about over here? Okay, what you would do is you're injecting in between the lines. All right, you don't need to go in between each set of lines. You're not going after every line. the medicine is going to diffuse in this area. So each injection zone, I go 2 units, 2, 2, and just keep going around in that area. So that person may need 16 units in that area. Would give a pretty nice result. I think 16 units. Okay, how about this one? You're going to see a lot of this where they've got they've got these rhytids all the way around. So the question then you should ask is, well, how far around do I go? And I'm going to show you in the next slide, because you have to be careful. If you get too carried away, all right, and you start injecting and you go too far forward, you could definitely run into a few complications. But I'll show you how to avoid that. So what do you think you'd do here? You could go 2 units at every spot. That might be a 24-unit patient. Okay, there's a lot of lines, and they're pretty pronounced. So that could be a 24-unit patient.
So you're not just saying you do it at those particular points. There's more.
Right, I would do more. This would give a nice, if you just went 4, 4, 4, 4, and you did 16 units, you're going to get a pretty nice result there. But I would probably go 2, 2, 2, and go all the way around. And really, really, if somebody really wants a good result, you know, do that whole area. But you can just start, in that case, with 16 units, and you'll get a nice result. You know, again, that initial consultation is really important with the patient. The person may not really care too much about the cost. You know, they just want a really good result. And, excuse me, unlike the forehead, if you inject too much in the forehead, you're going to freeze their forehead, and they're not going to have any expression at all. But with the lateral canthal rhytids, excuse me, you're not going to freeze that area. So you can use a good dosage in that area. You can use 24, 26, up to 30 units, and you'll have a very nice result. Okay, so I'm looking for the slide that shows you how far not to go. All right, this is a pretty decent slide. All right, and what you have to be careful of is, you see how this went? You don't want to go too far forward. What you don't want to do is you don't want to inject all the way over here and then go too deep over here. Remember, you're using a 30-gauge half-inch needle. But still, if you go deep enough, you could inject into here, and you can inject the frontalis muscle. All right, because the belly, or the attachment to the frontalis muscle, is up in the zygomatic region, okay? Excuse me, the zygomatic and major and minor muscle, I meant to say, not the frontalis muscle. Frontalis muscle comes along the side. I meant to say that the zygomatic, major and minor. But if you go too deep, you'll hit that muscle, and what's the problem with that? If you hit that muscle, now you're going to affect their smile, exactly. They're going to get that drooping smile. So be careful, don't go too far. In fact, some people say, don't go anterior to the lateral canthal line. Okay, so here's your lateral canthal line. If you draw an imaginary line straight down, they say don't go anterior to that imaginary line. Okay, so that's pretty important. But some patients do have lines all the way forward. Okay, so you do have to have the discipline to stop. All right. The other thing is, let me talk to you a little bit about injecting underneath the eye. You can inject underneath the eye. It's kind of part of this procedure that we're talking about right now. But just be careful, because what you want to do is you want to make sure that you, on your physical exam, you do this pinch test. All right, and you don't want to do it on elderly patients. All right, the reason is, if they don't have good skin tonicity in this area, and you inject it, what's going to happen is they're going to get like this ectropion, all right, and their eye is going to come down like that. And it not only does it not look good, but it's uncomfortable for the person. So check it out. Do a physical exam. See if they have good skin tonicity, all right? And if they do, you can inject that. The way to inject that area is very delicately and carefully, for one, but the same technique I was showing you with injecting the lateral canthal rhytids. Number one, you want to protect the eye. So you don't want to, you know, point towards the eye. That's the first thing that's important. Okay, the next thing is, let me see if this helps. The next thing is, so pretend they have a line underneath their eye like this. Okay, what I usually like to do is, I usually like to come along the side like this and inject as I'm pulling out. All right, and how much are you injecting? Very, very small amount, typically 1 to 2 units per injection. So it depends how many lines. If they have a lot of lines, you're going to go in between each one of those lines and inject 1 to 2 units per injection. But I think, again, what's important is you don't want to inject toward the eye like that in case they move or you slip or something like that. All right, and again, the lateral canthal rhytids, you're standing on this side and you're coming in like this. So you inject, inject, and you're coming around like this. All right, not too far forward. See that zygomatic bone? Right there, it's pronounced. And if you inject right there and you hit the tip of that zygomatic muscle, you can have that defect. All right, and then you come around over here and you inject right beneath the eye. How does that sound? Does that seem like a doable procedure? I think really it's one of the easier ones, and we're going to practice that in a little while, and you'll see that it's really not difficult at all.